Good morning, everybody. I'm Dr. Pratibha Shah. I'm joining you from Boston, United States. I'm actually traveling right now and I'm signing in from a hotel where I'm staying for the night. So, delighted to join our colleagues, our students, our Ayurveda fraternity in Nepal. Thank you, Dr. Ramdev Pandit, for inviting me to share a few facts about Ayurveda practice in the West, and hopefully we can clarify some of the myths versus realities. So, I will begin by talking about my own journey very briefly so that you have an overview of where I started and how I landed in the US and what challenges or realities I faced. And through my eyes, I will be able to share what some of the realities are here in the US. I had actually prepared a couple slides, but because we are on Facebook Live, I will not be able to share those slides with you. So I started off as in India. Landing in Ayurveda is also a big story in my personal story in Ayurveda. How I landed in Ayurveda. I always say I did not choose Ayurveda, Ayurveda chose me. I was headed to be an architect, but destiny had something else in store for me. So I ended up joining Ayurveda BAMS. I started in Bangalore in BAMS program, and then I had to transfer to Mumbai, and that's where I graduated from. 1 year I worked in Mumbai hospital. Its name was Sadhya Hospital, and there I gained a lot of experience in different departments, including gynae and obstetrics, including ICU, including general surgery, including general ward, and also neurosurgery. So I had a variety of exposure, and that was my outlook at that time. I really wanted to gain knowledge. I really wanted to understand everything, not just from Ayurveda perspective, but also from the modern medicine perspective. So in my first year, second year, third year, where we had dissection of cadaver in our curriculum, I used to read up all the books available. So I have read Gray's Anatomy, Guyton's Physiology, Nelson's Pediatrics, etc. So that is something I do want to include in my journey, that I used to be very hungry for knowledge. So I used to read up those books. And then I graduated from Mumbai, worked a few months in this particular hospital. And then I applied for PG in NIA and BHU. And I got in NIA in the subject I wanted to do, which was Rasa Shastra. So I completed my PG in Rasa Shastra from National Institute of Ayurveda, Jaipur. And while doing my PG, my father, who was a big fan of government services, somehow convinced me to appear for the UPSC exam, United Public Service Commission exam, which places medical doctors or medical officers, as they're called, in central government health scheme, or what is basically Ayush ministry. So I gave that exam on the insistence of my father, and then I actually was surprised to be one of the 12 doctors selected all over India. And I was the only one from Rajasthan state, and my rank was 5th all over India. So that was a pleasant surprise. I was doing it just to satisfy my father, but I actually ended up getting selected. And this was all while doing my post-graduation. And I ended up giving the interview and joining the central services. So I was with Ayush Ministry right after my PG, and I served there for 13 years. And I was a chief medical officer when I left India for USA, because my husband got a job here, better job option here. So we all moved. And currently, the national advisors in Ayush are my UPSC batchmates. We were part of the 12 doctors. So had I stayed, of course, I had a very good career back in India in the government services as well. But sometimes life situations come up and you have to go with the flow of life also. So I landed in US and I landed as an immigrant on a dependent visa. So this is where I will start talking about Ayurveda and its status. So the first point I wanted to share was status of Ayurveda outside of India. So outside of India, basically the status of Ayurveda is not recognized. All right. So I would like to make a distinction between the growing popularity of Ayurveda outside of India versus is it recognized as a proper stream of medicine? That is very important. So this is something I would like you to note, that as of today, Ayurveda is not legally recognized in any country. There is a lot of effort and progress has also been made. So in some countries, we are beginning to see some progress in like Switzerland, in Hungary, in Mauritius. So there are some countries where progress has been made, and hopefully soon Ayurveda will be recognized in one of these countries. But in general, Ayurveda right now is not recognized anywhere in the world except India, number one. So this is something I encountered in the US as well. And to complete my own journey, I ended up giving GRE exam. And then after GRE exam, I enrolled in Masters in Public Health. This was my second master's program in international health in Boston University School of Public Health, which is one of the leading public health institutes. So I completed that in 2011, and on the basis of that and other things that had developed by then, I applied for my work visa in a very roundabout way. Wonderful, thank you. Also recognized in Nepal. Thank you so much. My work visa was also a case study, I can say, because I had to prepare a very personalized petition. You know, Ayurveda is all about personalization, right? So it was not on the basis of Ayurveda that I got my H1 visa or work visa, but kind of a combined petition on Ayurveda as well as MPH degrees. And I had to position in a certain way to get my H1 visa approved, but I did get it approved. And as of today, I'm also a citizen of USA, so status is not a problem, means legal status in US. Now, what is the legal status of Ayurveda in the US? Ayurveda in the US is not recognized. And health is a state topic in USA. So every state gets to determine, in addition to what the country laws are or federal laws are, there are state laws as well. Okay, I know most of the people in the eastern part of the world have an aspiration to travel to the West, to travel to European countries and figure out or experience how Ayurveda is in these countries and to try and promote Ayurveda in these countries. So what I'm going to say or share today is sort of going to address some of the things, FAQs you may have. I myself get a lot of emails about, what is the status, like, can I come and do a job there? Can I join your company, etc., etc. So here I want to now share with you very practical information, real information, and critical information that will probably help guide anybody who wants to travel or move to Western countries to practice Ayurveda. What exactly is the legal status? So again, in Europe and Americas, North and South America, Ayurveda is not licensed. So every country, and even Canada, Ayurveda is not licensed. So every country will implement laws differently. I will talk about the area where I am and also in general in United States of America. So once again, the status is unlicensed. Unlicensed, what does that mean? Unlicensed means that if you don't have a licensed profession, then you cannot practice that profession, because licensure means that it will give you your scope of practice, as well as it will allow your profession to bill your client visits. I'm not even using the word patient, right? Client visits to the insurance. So that is very important to note. And then in certain states, the laws are more stringent than the other states. As I said, health is also a state topic. So, for example, in Massachusetts, where I live, Boston area, where I live, laws are very, very stringent. So, in a state like mine, I have to really be careful. In general, in US, Europe, you have to be very, very careful. How? Okay. So I'll tell you in a little more detail how I adapted to my realities in the new country. And I have an interesting perspective, because I came from the very pure government service or government sector, and then I landed in the completely private sector. So I will give you that unique vantage point, how I kind of adapted to this new reality for my professional life. So first of all, I chose a master's in public health, first of all, to give me an alternate degree that would probably allow me work visa wise, etc. A lot of people will take some other professions, and I'll talk about that a little later, how they use another profession added to their primary profession or professional training to allow them to practice in US. So first of all, I want to say it's not a rosy picture at all. There is a saying in Hindi, "Patthar se tel nikalna." So some of you may understand this saying, but it basically means that you have to really drill the stones and take oil out of the stones. Oils, there is no oil in stones, so typically it's that hard. So one thing in general about the practice of Ayurveda in the US is that you cannot use a lot of terminologies that you have been using freely in India, because Ayurveda is registered and licensed in India. So you have to unlearn a lot of things, if that makes sense. So you have to unlearn a lot of things, and then you have to learn new things. So what are the things we have to unlearn? You have to unlearn to use words like patient, disease, diagnosis, treatment, etc., etc. So no clinical language can be used. Okay, that's very important to remember, because the minute you use clinical language, you are open to getting sued in the court of law. And getting sued is a very common thing in the United States as well as Europe. And if you get sued once, that's it, you are done. You will be wiped out. So that's a very important thing to remember when you think of how can I start practice in the United States, or even if you're considering or thinking about it. First, remember, you will have to unlearn a lot of things. Second, very, very important, you cannot touch the patient. No auscultation, no palpitation, no palpation, nothing. So that is something you have to remember, because that only licensed professionals in whose licensure there is a scope of touching the client, or patient, they can touch the patient. Otherwise, you cannot. If you do, you are again open to getting sued. Okay, and these legal suits are very bad. You can get imprisoned, jailed, and you can get hefty fines and compensations, etc. So it's very, very daunting when someone comes newly to America. It's very daunting, what can I do with this big degree that I have? How can I practice? So I went to the route of Masters in Public Health, because I thought public health would align and synergize and synchronize very well with Ayurveda, and at some point I could try and combine both of my streams of master's degrees and do something. Now, third thing I want to say is that wellness industry is quite gray in most of the countries. So what is wellness industry? Where you have supplements and herbs. Those industries or those sectors are not very well regulated, or traditional practices sector. So you can utilize these sectors to try and establish a wellness practice, okay? Wellness, not illness, not disease practice, no treatment, but wellness practice. And because of this, a lot of Ayurvedic professionals, BAMS, MD, BAMS, MD, PhD, actually come and either become a nurse, because nursing is a very lucrative profession in the United States, because first of all, you get a fast track green card on this, and second, you can get the nursing profession is actually, yes, Roshan, Mr. Dr. Roshan Baskota, yes, pulse checking is counted as palpation, but I do that because I have developed a very thorough disclaimer where I mention a lot of things. I will talk about that in a bit. So I was talking about nursing profession. So a lot of people get into the nursing profession because it's very lucrative, and it is actually, nurses are allowed to do a lot of things that doctors are allowed here. So nursing is something that a lot of people opt for, interestingly. And then the other surprising thing is that a lot of BMS and MD professionals, not become, but get a licensed massage professional certificate or training for 1 year. So they become massage therapists primarily because it has a license. And after training in massage for a year, then they will put up some kind of wellness board on their shop or organization or whatever. And then they use that licensure to touch the client and give like sort of very diluted panchakarma or something like that, because detox is a buzzword in the United States and the West in general. So a lot of people make their inroads in variety of ways, through massage therapy, through physical therapy degree, through nursing degree, through what else? OT, osteopath, through chiropractor, through acupuncture. So variety of degrees, even ND, naturopathy degree. There are 12 states in the United States that have given license for practice for ND degree holders, and ND degree is not a small, not a short duration degree. It's 4 years, so it's not everybody's cup of tea. Whereas massage therapy license you can get just for within 1 year. Dr. Ramdev Pandit, you will have to remind me about time whenever my time is up, because I can speak on this for a long time. So this is as far as the realities of the country are concerned, okay? License-wise, these are some of the things, the restrictions or challenges or barriers for practice in the United States. And different people work around in a different way around these realities. And a lot of people change their profession. That's very sad, but a lot of people do that. I was determined not to do that because I'm actually very committed, very passionate about Ayurveda. So I had absolutely no thoughts about changing my profession at any point. So how I practice, I will share a little bit about that. I have developed a disclaimer which is very thorough, which declares very clearly that I'm not a licensed professional in this country. And yeah, 1 second, I'll just answer that. Mr. Roshan or Dr. Roshan, sorry, your title is not there. So how I did it is that I developed a disclaimer which very clearly says that I'm not licensed in this country, and that it does talk about my qualifications, my experience. So just to let you all know, I have been in the field of Ayurveda for 30 plus years now. And when I came to the US, I started with volunteering. First of all, I would recommend to everybody, never think anything is, when you do a work, never think about it as, oh, this is not a doctor's work, or this is something that won't be useful. Instead of sitting idle, I would say, if anybody is planning to travel, start with wherever you are. So I started volunteering in a language school, Hindi language school, Shishu Bharti. I started teaching Hindi there because I was doing it free, of course, for the community. Then I learned that actually volunteering is looked at very, in a very good way. Okay. It's looked at in a very good way by the organizations and colleges in the US. So volunteering is very respected and very encouraged. So I did that, and then I started consulting for free. Little bit here and there whenever I could. Anybody who came to know who I am, they would request some recommendations. I started doing that. Then slowly I started at $10 an hour. And, I used to see 60, 70 patients per day in India when I was in New Delhi as in Ayush Ministry. And then after coming here, I started developing a proper personalized session, long, detailed history intake, all of that. And as of today, my sessions with one client, new client, are an hour long. So what a contrast. Starting from, maybe less than 5 minutes or 5 minutes or 5 to 10 minutes per patient in India. In CGHS, there used to be a big line outside the OPD. To now where I see one client for an hour, it's a big contrast. So I started developing my own style of consultations, etc. I have developed my own body type questionnaire, my own history intake form, my own disclaimer. I've also developed a form that is called A Typical Day in Your Life, where it's a 2-page form, right from morning, what time you woke up to the time you go to bed, everything in between, detailed history intake. So I started increasing my fee as well, and at some point I got, work visa. As of today, my consultation rate is $225 for the first intake. So it's almost $200 in general per hour, but for the first encounter, it's $225 per hour rate, which is a high consultant rate. So it's been a long journey. I'm also a senior faculty. So teaching is very safe. So I'm also a senior faculty for 2 big Ayurveda institutes. One is Kerala Ayurveda Academy, which is in California. They fly me there to teach. And the other one is in my own location. It's called Boston Ayurveda School, and they pay well. So teaching is very safe. That's another way of getting the profession into the country. I have also founded 2 nonprofits again. Your passion should drive you, not the money. I have always been driven by passion, not money. I'm the founder president of 2 nonprofit organizations. One is Holistic Health Alliance. The other is Council for Ayurveda Research. And Council for Ayurveda Research, and now Council for Ayurveda Research is an international nonprofit now, because we also have an India chapter, Ayurveda Anusandhan Abhiyan Foundation. And just last month, I organized a very successful international summit on COVID-19 lessons and emerging strategies in Ayurveda, which was very, very successful. We had the Ayush Secretary and Ayush Task Force Chairman, Dr. Bhushan Patwardhan, and somebody from embassy, a dignitary from embassy in Washington, D.C., USA, come and join us and bless us. And 29 speaker videos and whatnot. Dr. Ramdev Pandit also had bought the ticket for that. It was very reasonable and very cheap. But I personally have been driven by passion, and money came later, if that makes sense. I did not start for money. I think that's a very important message at the end that I would like to give. Be driven by passion for what you're doing. I was driven by my passion for Ayurveda, not for my own personal career. But you know, 2/3 of my hours, working hours, are actually gone in my non-profits, to tell you the truth. But money has come on the side, even by that 1/3, because of, I think, higher goals, higher purpose, dedication, commitment. So money has never driven me, and I'm at 55 today. I'm very happy with, very satisfied with where I am. I have a decent name. I consult all over the world now. All those things have come because of passion, because of commitment, because of sincerity and honesty. And those are the qualities I would like to share with all of you, that those qualities should drive us, and rest follows. Success and money will follow, but they should not never be the primary goal. So with that, I want to open for questions if you have any. And I hope, Dr. Ramdev Pandit, I hope your colleagues and the community in Nepal, first of all, I'm very excited to be connected with the community in Nepal, Ayurvedic community in Nepal, because I have never been to Nepal. I would definitely love to visit in my next trip. But very nice to connect through technology. So any questions, I would be very happy to take any questions at this time. And I hope you found it useful. Any questions, Dr. Ramdev? I'm not seeing the comments yet. Any questions at all? Probably there is a lag to comments. I'm not able to see any comments yet. So, Dr. Ramdev Pandit, do you want to unmute and maybe speak? Because, okay. Okay, I think there was a question here. One second. Let me see. Can there be issues with clients' medical insurance when we prescribe herbs like ashwagandha, brahmi, etc.? How we have to get out of legal issues? Okay, all right. Okay, good. And herbs also, I just wanted to say, I have been operating just on Agni, Yama and simple principles, because, herbs are not, maybe 5% of the formulary is available here. But I can tell you one thing, that coming from my country where everything was available, and now working in a country where not that many herbs and formulations are available, I have still had astounding success. Astounding success. Yeah. Dr. Ramdev Pandit teaching. So there are many Ayurveda schools already here, and also new ones being established. So teaching jobs just like you would teach in India, except these are not university courses. These are certification courses, and there are practitioner levels, but this is a different level of like practitioner degree, not degree, certification of maybe 1200 hours, etc. Certification, wellness certification is about 600 hours. And those kind of jobs you can apply. But again, the schools are selective about how you teach, because you have to adapt a lot to Western style of teaching, which is you have to dumb down some of these Sanskrit terms. They won't understand otherwise. So you have to simplify, and there you have to have some teaching skills for that. Yeah. Any other questions? Are we out of time? Dr. Ramdev Pandit? Any more questions here? I don't want to like discourage anybody from coming to the West and, propagating Ayurveda. we require that. I just wanted to share the realities. I'm a big proponent of promoting Ayurveda worldwide, so I definitely would want to encourage everybody who is thinking about this. I just want to say it's not a bed of roses. That's something I really want to convey, because it can be very, you may need to be very patient, very committed, very diligent, perseverant to reach where you want to reach. All of the subjects, general Kaya Chikitsa mainly, but there are a lot of people who have been very creative about bringing different types of different branches of Ayurveda into US. Like there is a course called Ayurdula, where like a Dhatri type of training is given to people in US. So by being creative, you can actually bring in a lot of other types of specialities as well. I myself do a lot of talks on geriatrics, Jara Chikitsa, so Rasayana, Vajakarna, that's very much in the wellness industry. So that's a very good fit here as well. If clients from states come to India or Nepal, shall we still be careful? No. Mr. Roshan, yeah, it's your practice is governed by the laws of your own land. So no, you are fine. I mean, you should always be careful, but not from the legal perspective. All right, I hope everybody found the talk helpful, useful, and thank you once again, Dr.